Hey everyone, it's Dr. Hodges, and today I want to talk a little bit about the advocacy component during Obesity Cares Week. I will have some links down below that you can go to so you can see some of the different legislation that is down the pike in terms of coverage for medications as well as with surgeries. But let me first kind of introduce and reiterate a little bit. First of all, why is this important? I think the first thing that we all need to know is that obesity is a disease. Almost 60% of Americans suffer from this disease. It is the number 2 preventable reason to, or preventable cause of from cancer. So, for instance, smoking is the number 1 preventable cause of cancer. Number 2, obesity. So it's not just, do you have high blood pressure? It's not just the complications from diabetes. It's not just ladies that are infertile because of their obesity. It's also the increased risk for cancer and all of the economic burden from all these different disease processes. That is why it is just fundamental that we change our approach to the disease of obesity. And a lot of times it is going to have to be at the macro or at the Congress level, because if patients have insurance and their insurance is not covering medication or it's not covering surgery, then they're not going to have access to care. And that is where the Obesity Care Advocacy Network comes into play. There was an act that there was a law that was introduced or that was proposed by Congress, and it was the TROA Act, the Treat and Reduce Obesity Act. And the main focus of that particular proposal was to try to expand benefits for weight loss medications to Medicare beneficiaries. And why is it important that we kind of focus on Medicare? And this is why. Private insurance, Blue Cross Blue Shield, United Healthcare, Cigna, Aetna, all of these guys, they kind of look to Medicare to kind of be like a base. And then it is from that base that they use to determine all of their coverage. So it's not uncommon for some insurance companies to not cover something if Medicare doesn't cover it. And then they like to tout, well, we do cover this one thing because Medicare maybe doesn't cover it. And they use that as something to hang their hat. But more often than not, reimbursement to physicians, reimbursement for hospitals, a lot of that is driven by what Congress sets as a baseline at the Medicare level. And so oftentimes when we're trying to change our treatment for different disease processes, whether it's obesity, cancer care, you name it, we kind of look at what is Medicare or Medicaid covering. We try to introduce legislation to change that, and then that can serve as a sounding board so that all the other insurance companies will kind of like fall in line and respond to. Right now, Medicare will cover bariatric surgery. By far, bariatric surgery is 5 times more effective. It provides 5 times the weight loss that medical weight loss does, that any of the medications, including GLP-1s specifically, what they offer. However, not everybody is going to be a candidate for bariatric surgery for a variety of reasons. Maybe they don't meet the BMI or weight requirements. Maybe they've had previous surgeries, and so from an anatomic standpoint, they can't physically have that surgery. So sometimes the only thing that patients can do is medicine. Or what I do mainly a lot of times in my practice is patients will have surgery, and then I also use medicine as an adjunct to help them along the way. Well, it's much more easy for patients to stick with that plan when their insurance covers the medication, so that price and cost is not keeping them from getting the treatment that they need. So that's just one of the many things that the Advocacy Network can provide. I know also, and I'll have a link to that below, but you can always go to obesitycareadvocacynetwork.com ASMBS, that is our Bariatric Society. They also have an arm that is specifically for advocacy towards Congress. Let me get that. So you can actually go to the ASMBS website and go to asmbs.org/obesitypac/. And that is going to be our political action committee that is specific not just to the disease of obesity, but also to the surgical treatment for bariatric surgery. Also, you can go to TRIO at ASMBS, TREO, and TRIO is the fundraising arm of ASMBS that also helps with fundraising for research, but then they also will provide funds so that can help towards our political action committee. So I really encourage everyone, get involved, write your congressmen, write your senators. You really do have a voice. We have some wonderful links on these different websites. I'll have them linked below. And you know what? If you are suffering from the disease of obesity, or if a family member or a friend are, guess what? You don't have to suffer in silence. There are wonderful providers that are here to help. And if you need to have help with access to care, there are a number of different organizations that are out there that are willing to fight for that access. Okay? So get that vote in and get your voice heard.